Can we have Dr. Sarnitha? Yes.
Good morning, everyone. My presentation is on ocular profile among bus drivers and conductors. The main aim of this study is to study the incidence of ocular manifestations among bus drivers and conductors in Gadag city. Public transport is the vital force of civic headquarters, connecting people to their destinations. Visual health of bus drivers plays a crucial role, contributing about 90% of the perceptual and cognitive inputs essential for safe driving. Bus drivers, by virtue of their profession, face unique and relentless visual challenges, including sustained attention and quick responses to dynamic surroundings. So, regular eye test and awareness of visual impairment can significantly enhance the safety and operational efficiency. It is a prospective study which was carried out in Gadag city among 100 bus drivers and conductors. Basic personal details and history regarding ophthalmic complaints were taken. The history of diabetes, hypertensive and any other comorbidities was taken. Visual acuity using Snellen chart, refraction, intraocular pressure, color vision, slit lamp, biomicroscopic examination and dilated fundus examination was done. It was found out that among 100 bus drivers and conductors, 18 were diabetic and 11 were hypertensive. Among all the ocular manifestations, refractive error was more common. Among them, presbyopic turned out to be the highest among the bus drivers and conductors. This study is an effort driven by the dual target of improving the benefit of these professionals and confirming the security of those who depend on public transport. With a focus on unique visual demands faced by these professionals, the study delves into ocular challenges and vision-related symptoms experienced during their work. This research combines the quantitative assessment of visual acuity, refractive errors, and vision-related symptoms with qualitative insights from the bus drivers. Similar studies have shown that the most common ocular morbidity was refractive error. In our study, the ocular manifestations seen were cataract 28%, pterygium 22.6%, presbyopic were 46.6%, and allergic eye disease was seen in 5.3%. Picharis et al. Reported that almost 20% of the two-wheeler accidents were caused due to collision with the buses. Vision function threatening systemic diseases were present in 25% of the drivers, out of which diabetes mellitus were 18.7%. In our study, it was 0.05%. I conclude that several bus drivers suffer from vision threatening systemic and ocular disease. Some of them require surgical intervention to retain fitness. Regular eye examination and vision correction not only benefits the bus drivers and conductors, even helps in safe and efficient public transport. The importance of regular treatment should be frequently emphasized, as poor compliance has been often reported in patients with long working hours. The drivers should be educated about the systemic diseases which can affect their driving skills, and they must be encouraged to seek medical help at an early stage. These are the references. Thank you.
These bus drivers were all government employees?
Sir?
These bus drivers and conductors were all government employees?
Illa, sir. Or like both government employees and private employees, sir.
Both?
Both, sir.
So, did you give some recommendation to the authority for their checkups?
Yes, sir. Most of them were of private, sir. Government employees, we got authority from them.
You see, because you have mentioned that a lot of, and one thing you have combined the data, the bus drivers and conductors, because the role is very different. The role of driver is very different than the conductor. So if you mix up the data, the inferences we get, they are not exactly applicable to the both the professions in totality.
Yes,
You get my point?
Yeah.
So ideally should have been the
Bus
problems of
drivers.
drivers and problems in conductors, because they are two different, and drivers obviously have very crucial role to play in the public transport.
Yes, sir.
So
One important driver your study, I would say it's very important. Do you know what is the government recommendation in terms of the best characterization educators should have, one driver should have, like, the government has to, government needs to issue the driving license. So do you have any idea on that?
Yes.
Huh? कितना vision होना चाहिए driver to issue a license, and in terms of field of vision, in terms of BCBA, have you thought about that?
Yes.
ये जरूरी है नहीं है? Huh? Because driving license is a must. और bus driver है.
So normal visual acuity and this fundus examination are done before giving issuing license, driving license.
So you should check it out that also. Okay, what is
Yes.
the recommendation from the government side? It is there. Okay, thank you.